Joining us live in our studio, Sports Medicine Time, and that's Dr. Joe Congeni from Sports Medicine Center at Akron Children's Hospital. I'm sure you were prepared for this. Danny Salazar, strain in the elbow. I guess describe, and I know you can't get specific with Salazar. I'm sure you haven't seen the x-rays or anything, but it seems like since June, Joe, tired arm, strain, he needs the rest. Now they're saying a strain, 3 to 4 weeks. What goes on there with that tendon in the elbow?
No, Ray, all bets are off. This isn't an isolated injury or a new injury. Same thing's going on with Strasburg, right? Almost exactly the same things. Take the media from Washington, what they're saying about Strasburg, they're saying the same thing about Salazar. What do those two great young pitchers have in common? What did they have done a couple years ago? Major surgery. They had, ulnar collateral, Tommy John surgery. Everybody thinks it's a real quickie, no big deal, and maybe you even throw harder when you're done. But there's issues that are related to that. So now the terms they're throwing out, forget about the terms they're telling you. They're throwing out general terms. It's musculoskeletal. Okay, they didn't tear the graft or anything like that of the ligament, but they both are struggling with, arm fatigue, dead arm syndrome. They just can't get back to the level they were at. The starts that Salazar had in between, did he look like the Salazar from early in the season?
Not at all.
Does Strasburg look like Strasburg? No. Neither of those two guys can be counted on much. I heard you even talking with Bobby yesterday, hoping against hope. Could he possibly, if we go 2 series, 3 series, maybe to the World Series, could he jump back in there? And maybe an inning or two, but he's not going to be the starter that he looked like early in the season, I don't believe. And so anything they're saying about musculotendinous, tendonitis, and other things, it's all related to the fact his elbow's not the same as it always was because he had the more major surgery. And after you have issues related to the surgery, you can't pinpoint just one thing and say this is what it is. So it's not like let's get down to the anatomy of what it is. It's just general arm issues in somebody that had the main ligament in the elbow rebuilt.
And we hear so often the positive stories about the Tommy John surgery. And like you just said a moment ago, sometimes they've even read where they come back and their arm is even stronger. So sometimes we don't hear the stories like this where it maybe hasn't responded as well.
Well, in the cases that we've dealt with, they may do very well for 6 months, a year, 2 years, 3 years, but ultimately down the road they sometimes run into problems, more so than people that didn't have those problems done. And that's what the surgeons try to tell these people. Don't be coming into us to say, hey, rebuild my elbow for a minor elbow problem. It's 12 to 18 months after you have Tommy John surgery, and then you're much more likely to have recurrent issues down the road. And both of these two young pitchers are dealing with recurrent issues relating to having the arm rebuilt, not necessarily just a little tendonitis.
Dr. Joe Congeni with us, Sports Medicine Center at Akron Children's Hospital. So with that being said, and they've already said surgery is not going to be required. They don't want him to pick up a ball 3 to 4 weeks for activity and that type of thing with Salazar. When you look at the long term with a guy like this, when you see this, and this has really been since June that he's had the arbor problems. I mean, is this something that goes away?
I'm worried.
Or is this something that is career-threatening?
I'm worried about it. It's career-threatening. And again, I'm going to say it because these two are parallel in both of these guys. So it'll take a lot of rehab, a lot of building them up, a lot of getting their innings back, and it won't be till next year till we start to answer that question. But you'll get a sense if you go down there for spring training by March and April and May of next year. But I don't think we'll get a good sense by the end of this year whether we need to, whether they're going to get back to the level of where they were ever again or not.
Wow, that's a big blow for this baseball. Yep. What else did you have on your list today?
Well, one of the injuries that's really a rarity, and so we learn off some of these things that are rarities, is a coracoid process fracture is an unusual injury. So RG3, just running out of bounds late in the game, takes a blow to the chest. In my career, I've not managed a coracoid fracture. They're unusual. I asked 2 of my orthopedic partners. One's been in practice 25 years, one 15 years. They both have had one orthopedic people, one case that they've managed. So these are really, really rare. As it would typical to be, the Browns put all their eggs in one basket with him and developed him this year and brought him in and got him ready for the season. And the fact is, it's a very rare injury. It occurs much more so in like motor vehicle accidents, like a car accident, a high impact blow to the chest. It's not really the shoulder.
Where is the break?
The coracoid process is just above the nipple line in the chest wall. It's a small bone that sticks out. You can feel kind of a bony prominence there. There's 3 important ligaments that attach to the coracoid. There's 1 important tendon. The short head of the biceps muscle from the arm attaches to the coracoid process. When you get a direct blow there, in the cases, I mean, there's so few in the literature. When you look it up, they talk about 40 cases or 50 cases when everybody brings all their cases together. In most of what I read about it, about 3/4 of those will be treated non-operatively and non-surgically, and in 8 weeks they'll get stronger and better, and about a third to 1/4 are treated with surgery, and they have good outcomes too. But if you're treated with surgery, it's going to be with internal fixation type surgery. It's going to be a lot longer with surgery. So in those cases, as it sounds like they're doing in this case, they're going to reevaluate him in 3 to 4 weeks, see if it looks like it's healing strong on its own. But in those cases that don't have surgery, do they put up with the rigors of taking blows from, NFL people and big people all the time? And you and I had the talk, unfortunately, a couple weeks ago about Romo and, some of the smaller quarterbacks that aren't quite as big and strong as the Bortles and Bens of the world. That these kinds of injuries seem to nag them and follow them around. And that was the worry for everybody. And here we go 3.5 quarters and already the big injury occurs.
This is such an elementary question, but I have to ask you this, and hopefully you understand where I'm going. RG3, and I don't want to use, maybe I should use the word, seems brittle
yes.
as far as that goes. When he has taken some significant shots in the NFL, and believe me, if I was taking the shots,
sure.
I would have the fractures too. So hopefully I can paraphrase this by saying it seems when he gets a decent shot, we've got something torn, something broken, that type of thing. With all your years in sports medicine, do you see or have you seen bodies that are just a little bit more brittle than other bodies because of the DNA makeup?
Yeah, I think there are some people who have injuries that follow them around, and I think, sometimes we can't exactly put our finger on why, but he is definitely one. He just looks like a track guy playing football, and track guys playing football, not the best combination anymore. Even at wide receiver, where you take a hit or two a game, but at quarterback where you're going to have to take 3, 5, 7 hits a game, even after you let the ball go and other things, not a great position for somebody like that, and he struggled with it, and now there's some real questions about his whole career. So I agree, there are some guys that seem to have those types of things following around.
So when they say reevaluate in, 3 to 4 weeks, they're saying 8 to 10 weeks. If that's a fracture there and it's healing, when could he come back
these
to
fractures
play?
show up pretty well. These fractures show up pretty well on even one particular type of X-ray we do. But in these situations, to know the nature, and as rare as coracoid fractures are, coracoid fractures. Coracoid, even the word is from Greek. I know Joyce was in here this morning with you. The Greek word that means raven's beak. It's kind of a curved bone. It's hard to fix, and the surgeons even told me, because you have to put kind of a curved, you can't put a curved screw in it. It's a curved bone or process on the scapula that's right in the chest wall, just above the nipple line, and a direct blow to that injures it. And so, they'll assess whether it's healing on its own or not. Like I said, in most cases, they don't operate on it. But in those cases that somebody playing like NFL football, if they have any question about it healing well, and then if they operate, he's done for the year. If they go the non-operative route, 8 weeks.
All right.
So that's one more thing. Do we have any other time?
Yeah, go ahead.
Just one more thing I wanted to mention is some of our kids, the cross-country runners and the people preparing for the marathon and everything like that, this time of year, they feel a little left out in the injury. A thing that I'm seeing a lot in my office and hear a lot of kids talk about in the cross-country world and other things, is iron deficiency. Sometimes iron deficiency, anemia, sometimes just iron deficiency. A lot of our female athletes have iron deficiency. And the way it'll manifest themselves, they just feel fatigued a lot during the day.
I have that, Joe.
Do you?
Yeah.
Their
I
performance goes down. You take a supplement?
Yep.
So this is what we need to do for a lot of, and they just can't figure it out. They're tired. Their times are going down. Their performance is getting worse. They're injured a lot. A lot of them are one injury after another, kind of like you were talking about with certain, and they feel feel like my hip's bugging me one day, then my knee is bothering me for a day. And a lot of times we take care of all of that. We check a value called a serum ferritin is the best to tell us in the last 6 weeks or so what the iron stores have been doing. And we build those iron stores back up. Unfortunately, it takes about 6 weeks to build those iron stores back up, but by giving these athletes iron. So for any of our runners out there preparing for the marathon, cross-country kids, endurance sports, even our soccer players, some and things, if you're feeling run down, you're having a lot of injuries, but we can't figure out why we're having a hamstring here and a hip here and all kinds of other things, get your iron checked. Iron deficiency, when treated, these kids can do significantly better. Do you do better when you're treated?
Yeah, I do. And I had, some blood work done. Has to go with my DNA.
Right.
What I heard from my doctors, you see a lot of people from Mediterranean background, Italian, Greeks, and that type of thing, have the low iron, and it runs in our family. So, I went there because I was feeling dragged down in some afternoons, so it's made a difference.
Very good. Yeah. Thanks, Ray.
All right, thanks, Joe. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, live in our studio Wednesdays.